Assalamualaikum and hi to Sir Yusri Jabani. This is our presentation for patient management and medical ethics in medical imaging. This is our group members, Batrisha Izzati binti Yusri, Nur Asyah Safiah binti Muhammad Rafi, Nur Aina Masarah binti Halim, Nur Amira Afifah binti Hashim, Nur Syafiqah binti Muhammad Aznan, Nur Hurin Sofia binti Hanaz, and Wan Nur Farihan Nabila, Wan Hairul Azran. Next, we move to content. Topic 1, Medical Ethics and Professionalism. 1.1 Describe the roles and responsibilities of radiographer before, during, and after radiological examination. 1.2 Describe medical ethics and professionalism. 1.3 Explain the code of medical ethics. 1.4 Explain the principles of medical ethics and professionalism. 1.5 Describe patient's right. Topic 2 Receiving patient. 2.1 Identify the sources of the patient for radiological examinations. 2.2 Describe the patient registration process and distribution of examination in medical imaging department. 2.3 Identify the types of X-ray room examination based on types of examination. 2.4 Explain the type of X-ray examination that needs appointment. 2.5 Describe appointment system for in and outpatient. 2.5 Describe some patient preparation before radiological examination. 2.6 Explain the patient care before, during, and after radiological examination. 2.7 Describe the hospital information system and radiology information system. 2.8 Describe the picture archiving communicating system PSCS. That's all from me. Thank you. Okay, we go to introduction. Patient management encompasses the assessment, diagnosis, treatment, and ongoing care of individuals while respecting their dignity, preference, and values. It requires building strong relationships, effective communication, and teamwork to provide holistic care. Ethics plays a crucial role in guiding healthcare decisions, focusing on principle and like beneficence, acting in the patient's best interest, non-malfeasance, avoiding harm, autonomy, respecting patient's decisions, and justice, ensuring fair care. These principles are vital for addressing challenges such as cultural differences and resource limitations.
Hi and Assalamualaikum. My name is Wan Nur Farihan Nabila. So today I will be sharing with you guys about the responsibilities of radiographer before, during, and after examination. We will start with the preparation before the examination. For the patient preparation, firstly, radiographer must confirm that the patient identity and medical history is true, and ensuring that the patient have already completed any necessary preparation to avoid any problems during the examination later. Second, radiographer must verify that the patient is not pregnant to avoid any radiation risk. The third one, the radiographer need to explain the procedure to the patient, answer the question that is given, and address patient concern. For the equipment preparation, firstly, radiographer will set up and calibrate imaging equipment, ensuring that all the equipment is in optimal condition. The second one, the radiographer will be checking of overlapping or leaking in the cable to prevent electrical hazard. Third one, radiographer will be preparing examination room by maintaining sterility and organization while adjusting the environment to make sure that the patient will be comfortable during the examination. So, we will be continue about the roles and responsibility of radiographer during their examination. In the examination, radiographer have to carefully guide and position the patient to image according to the requirement of the specific image technique being used, such as MRI, CT scan or X-ray, or may have to reassure the patient so they will not moving too much or feeling anxious during the examination. Other than that, radiographer may also provide protective lid shield for sensitive areas such as if appropriate to avoid radiation exposure. Also, radiographer must operate the requirement to capture the required image. They will monitor the image quality, adjusting as needed to the archive the optimal clarity and the best quality of the image. For the last one, which is during the examination, radiographer will assist patient of the requirement, offer guidance on any post-exam instruction, and monitor them for adverse reaction if contrast materials were used. Other than that, they will also let patient knows when how they will receive the results. For the last one, radiographer will review the image to ensure that the image clarity and proper position before submitting them to radiologists for analysis. Now, I will be sharing with you guys about the medical ethic and professionalism. So, what is medical ethic? Medical ethic refers to a framework for healthcare professionals to prioritize patient well-being, dignity, and trust. In other words, medical ethics is a branch of ethics that pertains to medical practice. It is a moral regulation and ethical principle for professional dealing with patient. So there is 4 pillars of medical ethics, which is autonomy, justice, beneficence, and non-maleficence. For the first one, which is autonomy, autonomy emphasizes about respecting patient rights to make informed decisions about their healthcare. Healthcare providers must make sure that patients are well informed about their treatment and are free to make a decision which is they want to do the treatment or they do not want to do the treatment as a gesture that their autonomy is respected. For the second one, which is beneficence, the principle promotes the well-being of patient which require acting with the best interest of the patient in mind of providing benefits to the patient. For the third one, which is justice, justice prioritize fairness and equality in medical treatment and the distribution of healthcare resources. Justice in healthcare means that the decision about who gets what treatment are made impartially without discrimination and with an aim to provide equitable care for everyone. The last one, which is non-maleficent. Non-maleficent is intertwined to beneficence and is summarized by the dictum of do not harm. It binds healthcare providers to avoid causing harm to patients. This principle is considered a minimum standard of behavior and care, ensuring intervention and balance carefully to minimize potential negative effects toward the patient.
My name is Nur Aina Maisara binti Halim. You guys can call me Aina. So today I'm going to share about the Code of Medical Ethics. Okay, this code is essential to guide healthcare professionals like doctors, dentists, psychiatrists to practice their work with integrity and professionalism. Its main focus is to prioritize the health and well-being of patients while minimizing harm. So there are 5 key principles in the Code of Medical Ethics. First is professionalism. Healthcare professionals must collaborate respectfully without discrimination based on age, religion, race, or patient status. Next is morality. Physicians should be honest, ensure fairness in treatment distribution, show empathy, and protect patient privacy. Third is good communication with patients and their family. Physicians need to build strong communication with patients and their families to prevent misunderstandings. Next is radiation protection. In treatments involving radiations, it's crucial to limit exposure for both patients and staff while using proper techniques. Lastly is confidentiality. Patient privacy must be respected, and exams by opposite gender physicians should have a third person present when feasible. The Code of Medical Ethics helps maintain trust between patients and healthcare professionals, and violating this code may lead to disciplinary actions. That's all from me. Next, let's dive into the fascinating principles of medical ethics. These principles are just rules. They are the foundation for compassionate, fair, and professional healthcare. First, we have respect for autonomy. This means you, as a patient, are the key decision maker in your care. Your voice is your concern. Next, beneficence and non-maleficence. A fancy way of saying that doctors aim to help, not harm. For example, through informed consent, patients get clear, honest information to make the best choices. Then, there are justice, because everyone deserves equal access to healthcare, no matter their race, gender, or background. This is fairness for all. Next is veracity. Veracity reminds us that honesty is the foundation of trust. Doctors must share the truth about diagnosis, treatments, and costs to empower patients. Finally, fidelity. Fidelity is about unwavering commitment to patients. Building strong, caring relationship leads to better health outcomes. Okay, these principles aren't just guidelines. They are about making healthcare ethical, respectful, and human-centered. That's all from me.
Assalamualaikum and hi everyone, especially to our lecturer Sir Yusri Benjamini, who teaches us in the subject of patient management and ethics. My name is Patricia Izzati binti Yusri, and today I'll talk about two topics. For the first one is 1.5, which is describe the patient's right, and the second one is 2.1, which is sources of the patient for radiological examination. Okay, for the next one is describe patient's right. So the first one is respectful and continuity of the patient's care. Respectful and continuity of patient's care are essential elements in ensuring high-quality healthcare. This includes demonstrated by listening to our patients, asking for their opinion, and recognizing the importance of incorporating their personal values. Next is the right to health care and human treatment. So, patients have right to receive treatments regardless of race, color, religion, gender, nationality, or disability. Other than that, the patient must be treated with care, consideration, respect, and dignity. Next is right to a choice of care. Patients have right to receive adequate information about their condition during the consultation and should have the right to accept or refuse the treatment. Other than that, the patient also has the right to decide if there are any second opinion or options suggested by the doctors. Another one is right to adequate information and consent. Patient must be informed due to the name and position of caregivers who will in charge of their care. Moreover, they also must be given relevant information on services and facilities. Okay, for the next one is to identify the sources of the patient for radiological examination in general preparation. So the first one is patient identity. Radiographers must ask the patient identification and check with the request form or X-ray form such as their name, their age, their identity card number, and their registration number as well. Next is LMP, which means last menstrual period. This is specifically must be asked to the pregnancy woman. Okay, and the third one is artifact. Artifact must be removed depend on the type and the part of the examination. The last one is explanation. Radiographers must give full explanation before, during, and after examination. And radiographer also must make sure the patient understands what the physician has explained to them. Next is preparation for the outpatient. Patient should be given written details of time and date of examination and a simple explanation of the patient. And then, patient also must be given full details of any preparation required that includes diet and fluid and prescribed medication. Okay, another one is patient must be informed about the possible effects of the medication may have on them and how long it is likely to last. Next is preparation before the examination. So the first one is radiographers must check and make sure the correct patient identity, such as patient's full name, identification number of patient, date of birth, and confirm with the patient correct examination and correct part. Next is explain to the patient about the type of examination. And then radiographers must ask the patient to change clothes and remove all artifacts such as accessories and it depending on the type of examination. Okay, the last one is radiographers must prepare the immobilization device and setting exposure factor at control panel X-ray. Okay, next is preparation during the examination. The first one, radiographers must practice breathing face with the patient before start the positioning, such as breathe in and breathe out. Okay, next is do the correct technique for positioning to avoid repeating the examination. Okay, for the third one, radiographers must apply the radiation protection to all patients in order to avoid from having the side effect after the examination. Okay, so for the fourth one is radiographers must remind the patient not to move and to make sure they follow all the instructions given. Okay, for the last one is radiographers must apply the immobilization devices such as sponge, straps, or sandbag to avoid patient movement and to ensure patient feel comfortable during the examination. Okay, so for the last one, after examination for outpatient. Okay, radiographers must inform the patient that the examination has complete and tell the patient that they can change their clothes and take their personal belongings. And radiographers also have to make sure to give instruction to the patient about where they should go after the examination done, either they can go home or they have to wait for the next procedure. Okay, for the inpatient, radiographers must inform the nurse in charge that the examination is finished. Next, radiographers should observe the patient and do not leave the patient alone until the nurse arrives. Also, radiographers must return the patient's folder, chart, or radiographs to the nurse in charge.
Assalamualaikum and hi everyone. My name is Nur Aisyah Shafia. Today I will talk about 2.2 describe the patient registration process and distribution of examination in medical imaging department. So for the registration process, I will divide it into two subtopics, which is the registration process for inpatient and registration process for outpatient. Registration process for inpatient, the first step is patient is usually required to provide identification including their name, date of birth, and insurance detail. Second step, the clinician upon deciding that a radiological examination must be performed will make an order online through CIS order management. So the third step, at the reception counter of the imaging department, imaging personnel at the counter will receive the order and subsequently check and verify to confirm whether examination requested can be accepted or not. If decision is not accepted, the imaging personnel will contact the requesting clinician by phone. If the requesting clinician agrees to the modification to the examination as suggested by the imaging personnel, the radiologist, MO or radiographer will modify the order in RIS, which will also be transmitted to the CIS. For those cases where the clinician needs to review the examination order, they will be required to modify the order through CIS. If the examination is not required, then the order is cancelled. If decision is accepted, the imaging personnel will check whether the requested examination requires appointment. If an appointment is required, they need to do appointment. For those examinations that do not require an appointment, the radiographer would proceed to perform the examination by viewing the word list. So after the examination complete, the patient will leave the room. Next, the radiologist will view the image or film and make a report to diagnose through the RIS. This report will then be distributed through CIS to the requesting clinicians. If the examination could not be complete, the case shall be rescheduled. For patient of unknown identity, the system should auto-match the patient information and image once the identity is made known from the HIS. For service not available within the hospital or due to equipment failure, the hospital shall buy service from outside as per local policy. Next, for registration process for outpatient, upon arrival, patients are usually required to provide identification upon arrival, including their name, date of birth, and insurance detail. Clinician will make a decision and request manually to the imaging department. The imaging personnel will receive and register the order. The order will be checked and verified to confirm the request can accept or not. If the decision is not accepted, the imaging personnel will check to see whether the modification to the examination can be made or not. If the order can be modified, the imaging personnel will modify the order. If examination is not required, then the order is cancelled. Once the order is accepted, the case shall be pre-registered at point of care as per PMS registration module using radiology registration number. The order will be executed in the RIS as per CIS order module. When the patient arrives on the day of examination, the receptionist shall acknowledge patient arrival and this shall match the PID to be issued. For examination requiring an appointment, the case shall be scheduled. For examination that does not require an appointment, the radiographer shall view the word list in order to perform the examination. So, upon completing the examination, the radiologist will view the film and make a diagnosis in the RIS. The report will be printed and distributed together with the film to the requesting clinicians. For case referred from private clinic or hospital, the patient have to settle the charge at the main registration counter and evidence of payment is required before forms and report is released to the patients. Hello, so we're still in the same topics. For now, I will describe the distribution of examination in medical imaging department. For general radiography, reporting shall be made upon request. Priority will be given to urgent examination. For examination that are not reported by the radiologist, image or radiograph will be made available upon completion to the requesting clinicians. For special examination, ultrasound report shall be made available immediately upon completion of examination. All special examinations involving patient shall be reported within 2 working days unless requested otherwise. All special examinations involving outpatient shall be reported within 7 working days unless requested otherwise. All special examination requests made of accident and emergency departments should be reported as soon as possible. Reports to ERCP case shall be made on request only. Set protocol for ERCP shall be prepared and made available to the clinicians. So for the next topic is 2.3, which is identify the type of X-ray room examination based on types of examination. So the first room is general radiography X-ray. have a 5-type X-ray, which is bone X-ray, chest X-ray, spine X-ray, abdominal X-ray, and hand, wrist, foot X-ray. Next room is fluoroscopy room, 6-type X-ray, which is barium swallow, barium enema, arthrography, cystography, fluoroscopy SSG, and fluoroscopic photography. Next room is CT scanner. Have a 10 types X-ray, which is CT scan angiography, CT abdomen scan, CT bone scan, head CT, CT scan chest lungs, cardiac CT, CT neck, pelvic CT scan, CT scan kidney, and CT scan of the spine. Next, we have a mammography room. I only have one function, is to check our breast. So next room is angiography. Have 7 types of X-ray, which is computed tomography angiography, coronary angiography, digital subtraction angiography, pulmonary angiography, magnetic resonance angiography, which is MRA, renal angiography, and radionuclide angiography. Next room is MRI. Have 9 types of X-ray, which is abdomen MRI, bone and joint MRI, brain MRI, breast MRI, cardiac MRI, pelvic MRI, spine MRI, and magnetic resonance angiography. Next room is ultrasounds. Also have 9 types, which is pregnancy ultrasound, abdomen ultrasound, kidney ultrasound, breast ultrasound, pelvic ultrasound, transvaginal ultrasound, thyroid ultrasounds, transrectal ultrasound, and Doppler ultrasounds. And the last room is intravenous urography. Have 6 types X-ray, which is conventional eye view, excretory eye view, retrograde eye view, CT urography, MRU, and pediatric eye view.
Assalamualaikum and hi to Sir Yusri Jamanin. I am Nurhurin Sofia binti Hanas. I will be present about 2.4 types of X-ray examination that needs an appointment. Number 1, intravenous urography, IVU, used to detect anomalies in the urinary system. It includes the kidneys, bladders, and ureters. Number 2, fluoroscopy. One of the tests that need fluoroscopy appointment is barium swallow. Another is hysterosalpingography, arthrography, and myelography. Number 3, magnetic resonance imaging, a non-invasive medical imaging test that produces detailed image of almost every internal structure in the human body. It includes the organs, bones, muscle, and blood vessels. Number 4, CT scan. CT scan is for brain, abdomen, and thorax. Number 5, mammography, an X-ray imaging to detect for presence of tumor or lump in breast. Number 6, ultrasound, for abdomen and reproductive system. That's all from me. Assalamualaikum and hi to Sir Yusri Jamanin. Next, we move to 2.5 appointment system for in and out patient. Number 1, patient registration and information. For new patient, we will collect demographic information such as name, address, and etc. and document medical history. For existing patient, we will verify patient information and update medical history as needed. Number 2, appointment scheduling. Patient initiated, patient contacts the hospital via phone or online portal and select type. Number 2, appointment scheduling. Patient initiated. Patient contact the hospital via phone or online portal and select appointment type. After that, patient confirm the appointment date and time. Hospital initiated. The hospital schedules appointments for follow-ups, referral, and procedures. Number 3. Appointment confirmation and reminders. System generates appointment confirmation by email or SMS. Automated reminders sent prior to appointment using email or SMS. Number 4. Check-in and waiting room. Patient arrive at check-in at reception, wait in designated area, and notified when it's their turn. Number 5. Consultation or procedure. Patients meet the specialist. Consultation, examination, or procedure performed. Treatment plan and discuss and prescription issues. Number 6. Checkout and billing. Patient checkout and billing process. Patient receive any necessary document. Appointment data recorded in electronic health records (EHR) and system analyze appointment date for trends and improvements. That's all from me. Thank you.
Assalamualaikum and hi. My name is Nur Shafika. You can call me Pika. And today I'm gonna share with you about 2.5 describe some patient preparation before radiological examination. For the first, proper preparation. A proper preparation is essential to ensure a patient safety and accurate result. 2. Consultation before the procedure. Patients should inform the technologists if they are pregnant or breastfeeding. Radiological examination is dangerous for the fetus. Number 3 is a need for fasting. Some X-ray exams require a patient to fasting for about 8 to 12 hours. Number 4 is attire. Patients should wear loose, comfortable, can be easily removed. Number 5 is remove jewelry and metal objects. Patient must remove jewelry, glasses, and other metal objects. Number 6 is empty bladder. For abdominal X-ray, patients should empty their bladder and avoid excessive drinking on the day of the exam. For number 7, contrast medium. Some exams require drinking or ingesting a contrast medium, barium or iodine, to help highlight areas of the body. Number 8 is maneuvers and positioning. A proper positioning is a key for accurate result. Number 9 is mammography. Avoid using powders, deodorants, or perfume on the day of the exam, as they can interfere the image quality. And the last one is a pain. X-rays are generally painless and quick, with most exams taking only a few minutes. Hi, it's me again. For the next subtopic is 2.6 patient care before, during, and radiological examination. For the first one is patient anxiety and communication. It is important for a radiographer to provide a clear communication. Number 2 is room preparation. A clean and organized radiographic room promotes a smooth procedure. Next is screening and consent. The physician must ensure the patient is screened for any relevant health conditions. Next is anesthesia or sedation. If sedation is needed, the requesting doctor must coordinate with the relevant department. Next is special care for patient. The special patient requiring a special care need a close attention during the procedure. Next is contrast allergies. A proper screening for allergies should be conducted before the examination procedure. Next is a diabetic patient. A diabetic patient on metformin require a special attention when IV contrast is used. The conclusion is a proper communication, preparation, and attention to a specific patient that ensure a safe and efficient radiological procedure. The radiographer must always coordinate with the appropriate medical teams and follow established guidelines for sedation, contrast use, and patient care. Next is patient care during radiological examination. First one, the IR protection. Protecting the imaging receptor is crucial during a non-bulky techniques. Next is equipment setup. A proper equipment setup is essential for an efficient and sterile procedure. Next is a sterile handling. Maintaining a sterility is critical when working in sterile environment. Next is a special equipment. Special equipment may be needed depending on the procedure. Coordinate with the OR supervisor for any special equipment required for the procedure. Next is patient positioning. A proper patient positioning ensures an accurate imaging. Next is maintaining stillness. Radiographer must help the patient remain still during the procedure to avoid unnecessary radiation exposure and make the process more comfortable. Radiographer also need to provide clear instruction to minimize the movement, which reduce stress for the patient. And the last one is a patient care after the radiological examination. First is linen handling. A proper handling of contaminated linen is important to prevent contamination. Next is sedation. The requesting doctor is responsible for overseeing sedation during the procedure. If sedation is not feasible in their department, refer the patient to anesthesia services for appropriate management. The next one is emergency procedure. In case of emergency case, immediate action is needed or required. Activate the Code Blue protocol if the patient's condition required an advanced medical intervention. Next is documentation. An accurate documentation is essential for patient safety and legal compliance. Radiographer must ensure that all relevant details are recorded promptly to maintain a complete patient record. For image storage and retrieval must be secure and efficient. That's from me.
Assalamualaikum and hi. I am Nur Amira Afifah. So I'll be presenting about hospital information system. So what is hospital information system? It is an electronic system that collect, store, retrieve or display overall patient data and also information. HIS also manage all aspects hospital operation such as medical treatment, administrative, financial, legal issue, and also corresponding service. So in short, HIS is the main software that runs all aspects of hospitals. HIS also helps hospitals run smoothly by organizing patient information, supporting staff, managing resources, and also improving overall hospital management. So lastly, it also supports healthcare staff by accurate, real-time information, enable quicker response time, and better treatment outcomes. It allows multiple healthcare staff such as doctor, nurse, or specialists to collaborate and share information to making sure all the staff align of patient treatment. Next is RIS, which is Radiology Information System. So what is RIS? RIS is a type of radiology software solution for storing and managing medical imaging data. It automates data management, but is adapted specifically for radiology departments. So RIS complements with HIS and also PACS. So RIS helps
streamline the workflow in radiology departments, which is it can track the status of imaging procedure and ensure the right equipment is available, which it will reduce the delays and also optimize the use resources like uses of MRI machines or extra equipment. So healthcare staff can track a patient's entire radiology history from admission to discharge and coordinate the history with past, present, and also future appointments. With a quick access to accurate and up-to-date imaging data, healthcare professionals can make more informed decisions, leading to better diagnosis and treatment outcomes for patients. Lastly is Picture Archiving Communicating System, PACS. So PACS is a computerized system that stores, retrieves, and manages medical image and reports. It serves as a digital archive that replaces the need for physical film storage and providing a healthcare staff with immediate access to image, which can improve accuracy. It supports many image types and saves hospitals from storing image in physical film archive. The digital image can be stored off-site in a server and retrieved as and when needed using a computer, workstation, or a mobile device from anywhere. So as you can see in the diagram, the image and reports from the machine will transmit digitally to physician or radiologists and ensure the secure storage and meets the strict data encryption requirement. Radiologists and other healthcare staff can instantly access the patient image and reports, which will reduce delay in diagnosis and treatment for the patient. It enables clinicians in different locations to review the same data simultaneously in order to collaborate or consult on a particular. So, to sum up, patient management and ethics are closely connected in healthcare. It is important to provide a compassionate, patient-centered care based on strong ethical principles. So, healthcare professionals must consider not only clinical treatments, but also the emotional, psychological, and social needs of patients, ensuring the fairness, respect, and dignity. Ethical challenges require clear communication, informed consent, privacy protection, and also trust. As healthcare changes with new technology and societal shift, healthcare staff must regularly review the ethical practice. In the end, including ethics in patient care improve both health outcomes and overall healthcare experience, creating a more compassionate and fair system. That's all. Thank you.